Dr. Surabhi Bansal.
Benigal. She is going to talk about predictability of microkeratome LASIK, flap thickness. Are we cutting the exact?
Good afternoon, everybody. I am presenting on predictability of microkeratome LASIK flap thickness. Are we cutting the exact? So as we all know, corneal flap creation is one of the critical steps of LASIK surgery, which can either be done mechanically or using femtosecond laser. And we prefer in getting regularity and reproducibility of these flaps, as this guarantees safety of the procedure and influences the visual outcome. In our study, we used the Moria 1-use plus SBK microkeratome for flap creation. And the purpose of the study was to determine predictability and consistency of corneal flap thickness using the SBK microkeratome, wherein we studied 90 consecutive eyes undergoing LASIK surgery by a single surgeon at a single center. We included all eyes which underwent LASIK surgery as an initial refractive procedure where flap was created using either the 90 or 130 micron head, and the necessary preoperative investigations for LASIK surgery were performed. All flaps were created using the Moria SBK microkeratome, either the 90 or 130 head, which was based on the pre-op Paki, and we took 540 microns as the cutoff. Nasal hinges were created. The right eye was operated, followed by the left eye, and the same blade was used in bilateral cases. We used the manufacturer nomogram for the ring size calculation, and the examinal laser was performed using the MEL 90 machine. 1 week post-op, the AIOC2024 was done to measure the flap thickness using the zoom and contrast function, and the flap dimension uniformity was measured at the center, nasal and temporally along the 6 mm optical zone. So in our results, we can see that most of the patients in the 90 micron group achieved a post-operative flap thickness ranging from 110 to 119 microns. We compared if there was a correlation between the flap thickness with the age, spherical equivalence, teeth cake, and the pachymetry, but we found no such correlations. So the mean corneal flap thickness in the right eye was found to be 110.84 microns and 110.32 microns in the left eye. So these were the few previous studies which have shown similar kind of results with the 19 micron head, microkeratome head. And in the 130 group, we saw that maximum patients achieved a post-operative flap thickness ranging from 135 to 140 microns. Again, no correlations were found with the flap thickness to the age, spherical equivalent, pachymetry, and steep K. The mean corneal flap thickness in the right eye was found to be 132.4 microns and 131.43 microns in the left eye. And this was a previous study which had similar kind of a study which found a corneal flap thickness of as high as 153.3 microns, which ranged from 102 to 179 microns. So to conclude, thin flaps decrease risk of corneal ectasia, help in achieving thicker residual stromal bed. The Moria 1-use plus SBK microkeratome with 190 or 130 micron blade is a safe procedure as shown in this study, in which no incomplete flaps, buttonholes, or other microkeratome related complications were found. We were able to achieve thinner and more predictable flaps. Thank you.
I think these studies have been already done. Anything new you have done?
So with the recent evolution 3 machine of the Moria SBK, there were not many studies. Rather, there is no study wherein this simultaneously the 90 and 130 head has been compared for the flap thickness.
With the advent of thin flaps and SBK, I think complication rate has gone down tremendously.
Were these patients also offered femto option?
At our setup, we do not have femto.
You don't have. So these patients were not offered femto option. So that's a wide variation. Nearly 20 to 30 micron variation is there.
But that can be explained based on cases that clinicians, that 1 to 2 weeks of post-operative period, there is some amount of epithelial thickness.
Did you study epithelial thickness in all cases?
Maybe that can be
That
done
should
as
be
a
done.
subsequent study.
Why was there a more variation in the 90 micron group as compared to the 130 micron group? If you saw the 130 micron group was close to target almost, hardly a 5 micron variation what you presented. whereas a 90 micron had almost a 10 to 15 micron variation. Any reasoning for that?
Also, most of the studies have shown with the 90 head, the flap thickness has changed a lot. Either it will cut very less, at close to almost 110 or as high as 120 also. But in the 130 head, always the thickness has been consistent.
Again, in the previous studies, if I remember right, the left eye thickness of the flap was much thinner as compared to what you presented. Any reason why you felt that in your, because when you're using the same blade, the second cut always cuts a thinner flap.
Even we had, but it was a very minor difference, not
Did you increase the vacuum by 10 or so in the second eye?
no.
Then
Nothing
it
was
will cut equally.
Thank you.